Welcome to Retirement Lifestyles, where it's all about the health, wealth, and freedoms you need to live your dream retirement. I'm your host, Patrick McNally, and today Dr. Nichols from Enloe Behavioral Health is here to offer some tips for taking care of yourself while dealing with aging parents and other health concerns. In our lifestyle segment, Lori from Yuba Street Yarns will give us a live yarn spinning demonstration while telling us about how you can get plugged in to one of her classes. All that, plus how to educate your kids about responsible finances. Retirement Lifestyles starts right now. Hello, and welcome to our health segment of the show. One of the main things that I see a lot of in dealing and talking with retirees is depression and how we can function in our lives. You know, we've either lost loved ones or we've come down with a health issue, and depression can affect a whole lot of people. So I think it was really important, and I'm honored to have Dr. Nichols on the show with us from the Enloe Behavioral Health Center. Dr. Nichols,
thank you.
We appreciate having you on the show.
My pleasure to be here.
Thanks for joining us. If you could please tell us a little bit about your background, about your practice, and who specifically that you help.
Certainly. So my practice through medicine and my training took a couple detours. I actually started off in oncology, and I was really captivated by what cancer did to patients as far as how they responded to it emotionally. And as I got further in my training with that, I realized that was really the center of my interest. So I have a subspecialty, which is in cancer psychiatry. It's a very rare subspecialty. There's maybe a couple dozen of us in the United States. And that's part of my practice. And the majority of my practice is the medical director at Enloe Behavioral Health. And we operate a voluntary inpatient psychiatry unit. And we treat people with depression and anxiety and people who are having difficulty adjusting to major life events, as well as some of the things you'd normally think about with inpatient psychiatry, which would be maybe bipolar disorder or schizophrenia.
Cancer is one of those major issues that affects, I mean, you could probably ask anybody, and cancer has affected them in some way in their life. Not that they've got it, but they know somebody in their family. I know personally in my own family, have lost an aunt to cancer. And I've seen how that has affected not only myself and the feelings that I have, but the spouse and the children. How do you help people cope? I guess there's two areas we can go with. You've got the person who has the cancer, but then also the family members who are dealing with that. Let's start with the person who has the cancer first. How do you help them cope with that, and what kind of feelings do you naturally see that they go through?
Yeah, that's a great question. I'd say one thing that's important for someone who has cancer is that there's a normal, healthy process when people get this news that they adjust to it, and they have difficulty adjusting to it. And normally they adjust to that in a couple weeks as they find out, what the plan is, and they're moving along. Often, in the midst of the journey with cancer, people will get depressed either from an accumulation of losses or things aren't going the way they want, or sometimes the cancer itself or medications that they're being given actually provoke a psychiatric illness. And so my job is to sort that out. What part of this is medical and what part of this is adjustment. And there's psychotherapy that we can help people to adjust to losses they're having, psychotherapy to help them work better as a family, and of course there's medications that we can give when it's actually a biological depression that's either caused by the illness itself or by medications.
So you figure out either using one or probably all of those things, depending on the person, to what fits what their need. I know somebody who is going through like chemo treatments or something like that. You hear of, I've got good days and I have bad days. So are those some of the things that, when you work with somebody, you have to filter through exactly what they're consistently going through to find out if they need the psychotherapy treatments, like you said, or medication,
or both.
or even or
both.
Or both.
Absolutely.
Okay.
And I think this is, the segue to the larger population of people who are aging,
Okay.
is that there are a lot of things that get called depression that really aren't major depressive disorder per se. And that is really important to sort out. Sometimes on our behavioral health unit, we get people who are thought to be depressed and they have a sinus infection, or maybe they have some other illness that just makes them feel terrible. And for someone who hasn't spent their life being sick or depressed, they get these symptoms and it's interpreted as depression and they don't get better and they end up on our unit. And that is a perfectly, reasonable place for them to end up, where someone can stop and look at the whole picture and do necessary tests and find out what's going on and get them on a better track.
Dr. Nichols, talk to me about now the other side of the coin, the family members who don't have cancer, but they're helping and dealing in their own way with a loved one who has cancer. Is it the same kind of thing? Do they need psychotherapy? Do they need medication? Or is it a totally different
Not always,
as well?
but sometimes family members really can benefit from professional help. I think there's often a sense of futility and frustration and desperation, and sometimes those can provoke families into really interacting with each other in a way that's not helpful, and really doesn't help the person with cancer do as well as they could, and really doesn't leave the family in as good a shape as they could be otherwise.
Okay. Now, we've talked obviously a lot about cancer, but there's other triggers to depression. What have you found specifically with retirees, some things that maybe have triggered anxiety or depression in their lives?
Well, that's a great question, and I see this a lot with older people. There are natural losses with aging, losing one's vigor and vitality and athletic prowess and sometimes place in the community. And one of the things that I often work with people is that in our society now, when people retire, they are much healthier and have a lot more life ahead of them than people did when they retired in the 1950s.
Right.
If you think back to the 1950s, with a retirement age of 52, the life expectancy was 51. So most people were expected to already be dead.
Right.
And now we retire at 62 and have a life expectancy of maybe 78 or 80, 20, 30 years of healthy living. There is something in the human being that does not want to be sedentary, that people really need to think about their retirement years as being another period of activity. And then when their health doesn't allow them to be as vigorous, there's another natural thing, which is a time of reflection and making sense of life, and maybe think about legacy building. People who don't navigate that often think they're depressed, and in some sense they are, but it's not the depression that responds so much to a drug as it does to changing the way they're thinking about their life.
So just having, some simple mind shifts just about where you are in life could be the ticket, if you will, to help them feel better about themselves, not necessarily having to take a pill.
Exactly. Yes. And those things, though, sometimes it's not, even though it sounds simple, it's not so simple. And if they need professional help, that's when we can come in, either outpatient psychotherapy or seeing a family practice doctor. But if people's life starts to go where they don't want it to go, and they're starting to lose their ability to function or be happy or interact with their family, then that's really the time to consider maybe an inpatient psychiatric stay. Those are a lot of the people we get on our unit.
Dr. Nichols, where can people reach out to you if they're feeling this way right now and want to talk?
Yeah, thanks for asking. Our nurses station is open 24/7, and it's area code 530-332-5250, 332-5250. And if someone calls, our nurses will do an over-the-phone assessment or bring them in if it seems appropriate, and if it's not appropriate to be on our unit, try and point them to where they can get some help.
Dr. Nichols, we appreciate having you on the show today.
Thank you.
Folks,
Pleasure
if you're
being
feeling
here.
this way, reach out to Dr. Nichols today and get you feeling a whole lot better in your retirement years. Thanks for joining us. When it comes to teaching kids about money, the sooner the better. Up until they start earning a living, and sometimes well beyond that, kids are apt to spend money like it grows on trees. Today's show will help you put your children on the road to handling money responsibly. Long before most children can add or subtract, they become aware of the concept of money. Any 4-year-old knows where their parents get money. The ATM, of course. Understanding that parents must work for their money requires a more mature mind, and even then, the learning process has its wrinkles. Once they learn how money works, children often display an instinctive conservatism. Instant gratification aside, once they learn they can buy things they want, like candy and toys, many children will begin hoarding every nickel they can get their hands on. How this urge is channeled can determine what kind of financial manager your child will be as an adult. It's important to work on your child's financial education early on, because once they're teenagers, they're less likely to heed your Yoda-like advice. Besides, teens are busy doing other things, like spending money. When your kids are young, managing small amounts of money helps them prepare for the day when the numbers will get bigger. What's the best way to teach your kids about money? Pay them. There's a strong argument that an allowance is the best way to teach a child to handle financial responsibility. There's an equally convincing case that nothing could be further from the truth. In either event, before they get an allowance, a child should be old enough to count money. The key to a successful allowance is structuring it right from the beginning. Make it clear to your kids what kinds of expenditures the money's for, and that they're expected to save some of it. Some experts think parents should not link the allowance money to household chores. Children should be expected to help out around the house and in the yard because they're members of the family, not because they're paid. That's your call. Yet with kids over 8 or 9 years old, giving an allowance doesn't preclude paying them for specific chores, especially the occasional type that you might otherwise pay outsiders to perform, like mowing the lawn or washing the car. Why not keep the money in the family? Some parents complain that giving their children allowances puts the parents in a position where their kids are often begging for raises or advances. Remember, allowance is supposed to be a teaching tool, and negotiation skills are an important part of that, which they're going to need for dealing effectively with friends, teachers, and eventually their bosses. So instead of grimacing when your kids hit you up for a raise, decide when the time is right and then engage them in fruitful negotiations. How long since the last raise? Will new expenditures be covered? Are more responsibilities expected? The biggest decision on allowances is how much a decision affected by personal values, family income, and common sense. Don't let your kids pressure you with an amount based on what their friends are getting. Any normal kid will bring in high figures. One way to encourage your children to develop sound money discipline is to make savings a condition of their allowances. So try to account for this when deciding on a weekly or a monthly figure. What if your kid doesn't like to save? Try the carrot and then the stick. This, of course, means setting a budget and deciding what to do with children run afoul of their own guidelines. One answer is to place savings into a locked box. But since this doesn't teach restraint, and you won't always be around to oversee savings deposits, there are more instructive ways to make the point. You can use specific percentages and split up the money into a few different jars. If you've been teaching them from an early age, older children shouldn't have trouble understanding the concepts of long-term and short-term saving. If not, illustrate the concepts by using goals, as with a new video game a month from now versus a bicycle this summer. Once children reach the age of 9 or 10, time to learn about banks. Quantitatively adept children at this age can understand the concept of interest rates. Until they're old enough to handle a checking account, children may take withdrawals as cashier's checks or money orders. The best way to encourage sound spending habits is to model them. When planning a trip to the grocery store, get your kids involved in making a list and sticking to it. This will teach them to avoid the bane of all savers, impulse buying. For big-ticket items like appliances, show them how to do the research, reading articles and reviews, even phoning stores to see if your choices are in stock, negotiating with the salesman on a price, going to several different places to see what's available, and comparing prices. Now let's talk about older kids. With credit card offers coming in as fast as party invites, college freshmen need some guidance. The typical college freshman is burdened enough by school responsibilities, homesickness, and self-doubt To keep tomorrow's freshmen from suffering the additional stress brought on by a first checking account, start them off sooner, as early as their junior year in high school. Initially, keep it simple, avoiding any frills or extras like overdraft protection. They need to learn and experience the reality of a bounced check to understand record-keeping responsibilities. Many college freshmen today have credit cards, and if your kid is to be one of them, then this too has a learning curve that is best experienced under your guidance. Before your kids acquire their credit cards, they'll need a lesson in how to use plastic responsibly. Point out that this is where most people get in trouble, and illustrate your point with interest tables that show the damage that average nearly 17% annual interest, compounded over the years, and what that can do to their savings potential. Also, tell them that credit is a privilege, not a right, and that if they abuse it, they'll lose their ability to get more. After teaching your children the hard money lessons, show them the rewards of financial self-control. Once your teenagers get a grip on credit, introduce them to the flip side, investing. Since your teens may have too much money collecting no interest in a checking account, the best way to start is with a money market account on which they can write a few checks. From there, introduce them to simple, set-term investments like savings bonds and CDs. Though returns from these will be low, they serve an important lesson and will build their confidence about investing. From there, introduce them to the stock market, but don't make them pick stocks. Instead, advise them to get into some diversified mutual funds or a solid index fund. Some of the stock investing games available on the internet are fun and educational way